103.5 FM, New Haven's home for community radio. Insightful conversations, impactful ideas, and voices shaping our community and beyond. Let's begin the dialogue.
I want to say greetings to everyone. Today we will be focusing on early screening for prostate cancer, as it is critical for Black men because we face a high risk of diagnosis, a higher likelihood of developing more aggressive forms of prostate cancer, and a greater risk of prostate cancer-related death compared to other groups. So today we have with us our guest, my co-host, the Reverend Dr. Leroy O. Perry Jr., the Reverend Elvin Clayton, and our guest, Bishop Dwayne Anthony Walker. He is the bishop in the Amy Zion Church and presiding prelate of the Alabama-Florida Episcopal District. And you're listening to YCCI Community Health Watch Show, WNHH 103.5 FM. So we will begin and we'll ask our Bishop Walker, and say, first of all, welcome, Bishop.
Thank you.
Can you start by sharing a little bit about yourself and about the role in the church, your role in the church and the community?
Thank you so much, Dr. Blue, and my pastor.
Yes, sir.
It was so wonderful to be on with you and Reverend Clayton and Dr. Perry and Sister Davis. God bless all of you. I'm very pleased to have been a member of the Amy Zion Church all of my life, and has served as a pastor for over 30 years until last year. I was pastor of Little Rock Amy Zion Church, where you currently serve, for 19 years, and grateful to have been involved in the community at every place I've served, but particularly in Charlotte, where we're able to really serve at a greater level and serve on the planning commission and other things we're able to do in Charlotte, opening our doors for the community to be there to meet and to deal with whatever issues that may arise with our people and our community. And we were able to even negotiate with the city of Charlotte to attain some land where we were able to build 105 units of housing, which we call Varick on 7th, which provides both market rate as well as affordable housing for those who reside there. And so now I am blessed to have been elected the 111th bishop in line of succession in Amy Zion Church in July of 25, and now serving as the bishop of the Alabama-Florida Episcopal area, and grateful for that opportunity to do that.
Thank you, Bishop. So on January 25th, 2025, Little Rock Amy Zion Church, we partnered with the Prostate Health Education Network, known as FIN, to host a landmark event where we had so many from the community, churches, and other organizations to come out so that we could educate our community on prostate cancer. The beauty was FIN is a very recognized organization who has the expertise to provide the resources and the individuals to help teach our communities about prostate health. And so that was one of the reasons that we partnered with them. It was through Bishop Starnes. He started this initiative, and FIN wanted to partner with the Amy Zion Church, in which they did. And with the partnership through our Men of Zion, now we are launching it across the entire connection. And so the beauty was we had a good group of men to come, and we heard from experts, doctors, and others were able to be tested at that event. So Bishop, quick question for you. Why did you attend the FIN rally at Little Rock Amy Zion Church?
Well, I was invited by Reverend Moore. Reverend Scott Moore said, Bishop, you're in the area on this particular date. It would be good if some of our bishops would be present. And if you could come, we'd love for you to be there. Of course, it's being at Little Rock. it was no brainer. And I was in town. Of course, I would come by and be a part of that gathering. And so glad that I did. Um, Listen to um, the information that was shared, some of which I was familiar with, some of which I was not. I did know of the high risk and high rate of prostate cancer among our community and knew of the importance of why we should have been involved there.
Mhm. Yes, sir. Do you remember going through the screening process and everything during the event? Can you kind of walk us through the screening
Sure.
process?
After I heard the information presented, and I was about to leave. I had to. The event was still going on. They took a break, but I had to leave. And before I left, I thought I would just be a good example. And I saw them across the hall screening everyone. I said, "Well, let me go in and get screened as well. Maybe someone else would be encouraged to do that. They see me in there getting screened." So it was a simple blood test. I went in. They were very, very professional. They took my information. They drew my blood and took my information and said I would hear from them. And within a few days, maybe a couple of weeks at the latest, I got information in the mail from them indicating that my PSA was a bit elevated. And they recommended I should see my primary care physician to share with them my status. And that's what I did. So let me continue.
Yes, I was going to just follow up with that. So, what was
Okay.
once you followed up? So, what was your immediate reaction once you followed up and they shared with you your results?
Well, when I first saw the result and their recommendation, it was startling. It was concerning. I had been to the doctor prior. In fact, I've always made it a practice to go at least once a year, if not twice. And each time I have gone, my PSA has always been very normal. And so it was. Although the last time I was tested, it had picked up more than I had seen it before, maybe one or two, um, as opposed to zero. And so when I saw the results this time, of course, it was concerning. My result, it should be 0 to 4, and mine was at, I believe, 5.2. And so since it was not so far above 4, I didn't think a whole lot of it, except to follow their advice and to seek my primary care physician, which I already had an appointment. And when I went there, I shared with them my number, the card that they sent me. I shared it with them, and that doctor tested me again. And my number, instead of being 5.2, was 4.6. And she said, well, it's still higher than it ought to be. And because of my dad having been a survivor of prostate cancer,
Mhm.
she recommended that I see a urologist. So she referred me to a urologist. And then um, the urologist, of course, when I had that appointment, um, shared with me why I was there and sent me through other tests, asked me many questions about my symptoms. Did I have blood in the urine? No. Did I have frequent urination? No. None of those things were happening with me. I didn't have any other symptoms at all. No pain, no anything. And so he tested me there the old-fashioned way, which I didn't enjoy, but it was something I went on and did to, just to check all the boxes.
Right.
And even when he did that, he felt that my prostate was normal,
Wow.
normal size, no nothing, So, and he had me, use a, pee in a cup, and I did that, and there was no blood in the urine. So he did all of that. He said, so the prostate looks fine. There's no blood in your urine. Everything's fine. He said, but to be on the safe side, you may want to have a biopsy because of your family history. And so again, to be better safe than sorry, I said, okay, let's do it. And we scheduled it and I had the biopsy. And I just knew that when I got there, that they were just going to check the box and say, okay, you had the prostate biopsy, everything is fine, but we're just going to keep you monitored, etc. So it was a shock
Mhm.
to me when he said, yes, you do have cancer in your prostate. And my whole world just seemed to flash before my eyes.
Yeah.
My heart dropped and my mouth flew open, I'm sure. And everything he was saying to me just seemed like a blur. I just didn't believe it was happening, that he
Right.
was saying to me that I had cancer. But I just heard what he had to say about it. He told me that what the next steps would be, and that he believed that it was early and thought that that was good, and he just thought, the next step would be some scans that I needed to do just to ensure that it had not spread beyond the prostate. And I did those scans: bone scan, um, um, chest scan, bone scan, pelvic scan, all of those scans I had. And fortunately, it revealed that the cancer was no further than the prostate, and that gave me a sign of relief.
That's
Yeah.
beautiful. And I just want to emphasize the importance of you taking the initiative to keep going forward and saying, even though it doesn't look like it, I'm going to take the next step so that we can just double check. So I
Mhm.
hope that the listeners will see the importance of, just because you don't see the signs in one area, that it's important that you take that initiative to continue to follow through with it.
Sure.
Um,
Especially if it's in your family history,
right.
as it is with my dad. Yeah.
Right, right. So we heard how you responded. So how did you communicate this diagnosis with your family, your friends? And I know personally you came to Revival, you shared it with me, and so
Hmm.
I
Yeah.
I learned, from you.
Yeah.
And how did you share?
Yeah.
And
It was
how did
actually
they
the very
respond?
next day the revival was going on, and I had just been diagnosed, and
Mm.
especially since I had it at Little Rock, the screening, you're my pastor. I thought I
Right,
needed you to know what was happening with me.
right,
It was an early information. I was just still processing all of it at the time. But
right.
the Lord gave me tremendous peace, as God does, and
Mhm.
I immediately, when I left the doctor's office, I called my father, and because he, was very concerned, and on my way home to tell my wife, I was talking to him,
Right,
and he said, "Well, this is not a death sentence.
right,
And new technologies and medical science has advanced, so and I'm sure they got it early, so you're going to be fine, that kind of thing." And he said, knowing that what he went through and that he's still, doing well, gave me further assurance. He's 85, will be 85 in October, and he's doing great. And he was diagnosed in 2014, and there's not been any recurrence at all of cancer for him. And so again, that gave me the thing I was dealing with most of all, beyond the whole notion of having cancer, is just how inconvenient this is,
yeah, yeah,
Um,
yeah, yeah.
I just got elected bishop, and why me? Why now? Why
Hmm.
this? Those thoughts came across my mind.
Right.
And then, of course, I went home and shared it with my wife, because she was going through some tests herself at the time. And, um, and ironically, the things that she was going through, her doctor almost was positive that she was being going to be diagnosed with cancer. But it turned out that, and I was assuring her, and
Mm.
it turned out that she was not. Her biopsy came back uh, negative, and mine came back positive. And so
Wow.
we were just really looking forward to checking the boxes on both of us, because we had a sigh of release once she, got her results back, and I just knew that mine was going to be uh, the same, and we were just going to have just hug each other and just be relieved that we did not that things were not what we thought it was going to be. But as it turned out,
Right.
I do have it, and so of course we hugged and we prayed, and of course she gave me all the words of support that a wife ought to do, and she did.
Right.
And then that evening, I called my children. I have four daughters, and I set up a Zoom call with them. I didn't want to tell them individually, I wanted to tell them at the same time. And so
Right.
we set up a Zoom, my wife and I, and we called them together and shared with them. Um, my wife is my second wife. My first wife passed away with bone cancer back in 2012. And so, of course, my daughters were mortified at the notion that I too have cancer after losing
Right.
a mom with cancer. So they're very concerned, but we gave them every assurance that I'm going to be fine, that it's early, and if you have to have cancer, prostate is the one you want, is what I've been told. Um, and so, with that, I go forth, believing that the Lord is going to heal me, and believing that all of the diagnosis I've received and the prognosis I've received are good ones. And I feel very positive about things, and um, at least I did, and feel very positive about things. And we go forth. We go forth with the treatment. Um, so that's where we are at this point.
Well, thank you for sharing that. And you spoke to the fact of how having that family connection helped you to deal with the news with your father going through it, him offering words of wisdom and also encouragement. Can you speak to us just a little bit about how your faith helped you to cope with the news and the subsequent treatment process that the doctor prescribed for you?
Well, I just believe that I'm God's servant, I'm God's child, and I trust God completely. And when I prayed, I did receive um, just this sense of peace over myself, and then, of course, hearing the prognosis from the doctor said to me, "You have every reason to hope." And then I said, "Well,
Mm.
yeah." And I talked to another doctor and said, well, the doctor said, I was saying, the doctor, "Well, at least I know it's treatable." Then I said, "No, it's curable." That's what the doctor said.
Yes, yes, sir.
And to hear the
Yes, sir.
doctor say it's curable, not just treatable, it's curable, gave me even added assurance. And then, of course, just staying in the word and staying in prayer and knowing that the people praying for me has just been an added blessing. So I don't even think about it much because I don't feel any differently than I did
Right.
before I knew I had it. I'm not in any kind of pain. The medicine I'm taking makes me a bit lethargic at times, but I've been trying to do things like work out and whatever to keep my strength up and to stay focused and to stay busy so I don't dwell on it. I think at night, you're laying around at the end of the day, Satan messes with your head. So you have to stay prayed up and just
Right.
don't allow those kind of things to seep in to, well, the doctor said this, but you're not going to make it. What if this happens? What if that
Right.
happens? What if it spreads and all of that? And especially before I got the scans done, you always just think about the worst case scenario.
Hmm.
Um, these scans were going to may reveal something else that has gone, to your lymph nodes. So, when I got those results back, it really was helpful to know that. And even, let me say this too, even if it does spread beyond the prostate, they still can treat it. It's just that it has to
Right.
be more of aggressive treatment, but it can still be treated. And but thankfully, mine did not go beyond the prostate.
It's beautiful. Thank you, Bishop.
Mm.
So we're going to ask Dr. Perry and also Reverend Clayton to chime in here. And this question is to everyone because as we think about prostate cancer and some of the things that our men deal with, what are some of the hesitancies Black men in general have with being tested for prostate cancer?
Well, Dr. Blue, as Bishop stated earlier, that digital exam is one thing that the brothers don't much care for. And I remember very vividly when I went to for my physical, the doctor said, "Okay, it's time." And I said, "Oh, Jesus." He said, "Reverend, I know you want to see him, but I'm trying to help you stay here a little longer so you don't have to see him so soon." Uh, that's one of the challenges. We just don't like that, you know. And other challenges because we know that we are more likely to get prostate cancer than our white brothers and sisters. So just knowing that, it's a challenge for us. So those are a couple of things that I want to share at this time.
Okay, thank you, Reverend Clayton. Dr. Perry?
I think that, first of all, I just want to say how appreciative we are that the bishop chose to share his story. And that's part of what we do with this YCCI Community Watch Network, is that we try to take the stigma out of being sick and say anybody can get sick, and that there's hope for everybody. So that's one thing I want to say up front. And then secondly, I want to say how important it is for the Black church and for Little Rock to take on the task of making screening available to so many people who may not have the opportunity to have adequate health care. Now, about 25 years ago, I did the digital exam, and I gotten used to it. Because I just figured that it was almost mandated. Now the government does not mandate that. They say that because of the success rates with prostate cancer, you don't have to get screened when you go in. But it is important, as Finn would tell us, that we do continue to get screened because we are disproportionately affected. And when I got screened the last time, he said, "I think I found something. I need you to go see an oncologist." And so I did panic because I'm thinking, you know, everybody's getting this, and I guess it's just my turn. My wife came into the room with me, and the doctor said to her, "What are you doing here?" And I felt good about that. He told her to go back and wait in the lobby because there's no need for her to be there. And then what I thought, Bishop, was going to be an easy test. He had a camera. He was digging in to check out the prostate. He was doing the exam, and I heard this machine go click, and I felt something. Then he clicked, and he gave me no anesthetic or anything for this procedure. And then I clicked again. So after about the 8th time, I said, "When are we going to be done with this?" And he said, "Don't be such a baby." I said, "Oh my God." I want to get up and slap him so bad. And so then when it was finished, he told me, he said, "Well, we didn't find anything." But I could watch him looking in the camera as he was doing the probe for this prostate exam. This biopsy is what he called it. So, you know, I think that the thing that bothers me most is that as Reverend Clayton said, the digital exam. But what bothers me most is that Black men do not normally have primary care physicians. Black men do not have the money or the care providers to get the test. And I think that's why Finn at Little Rock and what Reverend Darrell Blue brought there and has brought to us in New England, because we're going to try to follow the same route. And I'm told that Bishop Crenshaw at his leadership meeting is also inviting Finn to be there to talk about the importance of prostate screening for African-American men who are 2 times disproportionately affected and fatally to die from this disease than their white counterparts.
I want to follow up with that to Reverend Perry and Reverend Clayton also. You kind of alluded to this, but what are some of the challenges and disparities faced by Black men in assessing prostate cancer screening and treatment?
Yeah, I just think that we've got to have more people like Bishop Walker, Bishop Monroe, and others who will be able to come and tell their story. Because I think the whole idea of having cancer is a stigma. that is, you know, you'd rather not find out that you got cancer because you think that it's fatal for you. And you know, that's one of the problems. How do you get rid of the stigma? The second thing is how do we, with the big beautiful bill coming, and people who are getting Medicare or Medicaid who might be canceled out from getting the screening or for getting the treatment. So that's why it's so urgent that we have this conversation right now. It's so urgent that we connect with organizations like FIN and PCEC, um, which advocates for early screening. That's important. And you know, one of the things that Finn had mentioned is one of the things the culture ambassadors had already talked about was we got to get women involved, mothers, wives, daughters, um, to say grandmas, to say to young Black men, you know what? Insist upon it, get it done because it's so important.
Right. Reverend Clay, you have anything you want to add?
That's so important. The comments that Dr. Perry just stated, to get the whole family involved, and the men will understand and that listen, we need you. You know, a mother will say, "Look, we need you." So if you have a problem, go get it checked. You know, and a lot of guys, you get around the barbershop or someplace just talking foolish. I don't want to go because I don't want to know if I got it. But you need to go, so if you have it, you can get treated. So, you
Plus,
know,
Right.
this program, we want the brothers to know that, listen, it's a 97% chance survival if you get it detected and treated early. And that's huge.
Right.
That's huge. Bishop said earlier, he said, if you're going to have cancer, this is the one to have. But it's not the one to have if you don't get it treated.
yeah, and see, and let me just say this real quick because I think it's important. I think the education part is important because a lot of people believe that if you have prostate cancer, impotency is going to be one of the things that you will automatically get, or incontinence will be something that you get. And back in the early days of prostate cancer, that was more true than it is today because the technology is better, the medicine is better, the treatments are better. You know, when now they got robots that can do this, they don't make mistakes. When the doctor's hand shake, he doesn't cut the wrong artery or the wrong nerve. And you know, with precision science now, like the screenings that the bishop talked about, the bone screening and the blood screening. I mean, those things bring about more precision medicine and it brings about better outcomes. I just want to make sure that, you know, that's important that we say that for people who may have that on their mind that, oh, I'm going to get, this is going to make me worse instead of better.
And I'm glad you said that about the treatment being better than before, Dr. Perry. I'm happy to hear you say that, that the treatment is better than it was. We had a conversation before this conversation that was not as hopeful. Because I appreciate you saying that, Dr. Perry. Almost signed off of this medium after talking to Dr. Perry. But anyway, we're good. We're good now. Thank you for that hopeful assurance.
Yes, sir. Yes, sir. Yes,
Yeah,
sir.
thank you so
So
much.
Bishop Walker, want to ask you a question because both Dr. Perry and Reverend Clayton talked about the importance of having screenings just at the local church, you know, and so what difference did it make being screened at a familiar and welcoming setting rather than going to hospital or clinic? Do you think that really matters?
Well, you know, especially after hearing the information, you know, I think that was very important. The persons that were there were very comprehensive in their sharing. It, you know, made a lot of sense. They gave us some examples. They talked about success rates. They talked about early detection and the importance of that. And then to have across the hall doctors or professionals available
Mhm.
to screen you. So after hearing
Right.
information and not taking advantage of it, it's foolish. So I didn't want to be a fool, so I went across and got screened. And I'm glad I did. I'm glad I did. And so if I had not been screened, well, of course, I already had an appointment already scheduled, but it certainly did heighten my desire to know where this was and what I needed to do to address it. So
Wow.
I would say the convenience of it is very important. Being in a familiar place, it certainly is also very important and helpful. And then, and the follow up, because one thing that my doctor said is that, because I said to my primary care physician once I went to my urologist and was diagnosed, I went back to her and thanked her for referring me. She says, I thank you for going because we refer, but but all men don't necessarily follow through with that referral. So she was thanking me for actually following up with the referral. So I would say that follow up with your referrals with your doctor and all of that. That once you, if it's especially if it's in the family, get tested. You can't, you're never too young or too old to do this. Get tested and just know your status. Just know it because it's so prevalent in our community.
Right. And I appreciate you saying that piece about you're never too young. I know me personally, I started when I was 40. I'm only 42 now, but I started early because
Mhm.
it is in my family also. And that was one of the reasons when Bishop Starnes asked me about hosting the event. I was like, yes, because this is personal to me because
Mhm.
my
Mhm.
grandfather had it and others in my family. And I was like, let me go ahead and get started now. There's no reason to wait until, what they were recommending in our 50s to get started. As you mentioned,
Mhm.
Dr. Perry, it starts early in the Black community with Black
Yes.
men.
Yes. Yes.
So we
Yes.
have
Yes.
to start early with the testing and not be afraid to be tested. So we're going to pause now here and want to thank our listeners again for tuning in. You're listening to the YCCI Community Health Watch Show on WNHH 103.5 FM. So, Bishop, what did you learn from participating in the screening event at the Little Rock AME Zion Church that you wish more men knew?
Well, the first thing is just how prevalent it is in among us. I think the number I heard was 1 out of 4 um, black men are susceptible to be diagnosed with prostate cancer. That's a high number, and I've heard varying numbers, but all of them are high um, in terms of the rate of positive test results after being screened. So that's something that alerted me. You sit in a room full of men, 1 in 4, that means a good number of us that's sitting there could
Right.
very likely be diagnosed with prostate cancer, as was the case with myself. Because when I
Hmm.
began to do those numbers in my head about how prevalent it was, I certainly did not believe that I was one of them. But sure enough, here I am. So that was the first thing, and secondly was just the fact that so the testimonies I heard about um, those who did not get tested and
Right.
those who did not follow up, and the results of those who did versus those who didn't. Reverend Scott Moore talked about 2 men in his church. He gave that testimony about one man followed up and got tested and screened and et cetera. Another one did not. And the one who did is still around. The one who did not, unfortunately, has passed away. So that
Right.
that that spoke volumes to me. And then the person doing the presentation, he was very effective. The doctor who did that was very
Yes, he was.
effective in terms of just breaking it down. And so all of that was helpful. I did not get to hear the second part, but what I heard was enough for me to go across the hall to get screened. Yeah.
Right. And you really did answer what I was going to ask you next because I was going to talk about how it changed your perspective on health screening and early detection, just being in that event.
Hmm. That
It
was very
felt,
helpful, very helpful,
yeah,
very helpful.
yeah.
Yeah.
So what advice do you have for other church community leaders who might consider hosting a similar event. And just as we consider our role in the Black church, not just the spiritual part, but ensuring that we are involved in those health initiatives. What do you say to your colleagues or to others, given your position?
Thank you for that question. And very, very important that we understand that we are to minister to the whole person. I thank God that Bishop Starnes sent you to succeed me at Little Rock, because that's what you bring as well. I've always talked about the need to minister to the whole person, mind, body, and spirit. And we've always made an emphasis at Little Rock about health, and making sure that we focus on that, and make that a priority. So if we would always have screenings of that sort, even when I was there. So I was so happy that that's being continued under you, and even your involvement with this program has taken it to another level, which I thank God for. But yeah, I would strongly encourage every church that is able to have space, whatever space you have, to make sure you um, make space available, but also pamphlets or other information that you share, that throughout the year just do things to encourage our people to be screened, not only for prostate cancer, but for diabetes that's prevalent in our community, breast cancer, of course, heart disease. All of those issues are things that affect the Black community, and we should always keep that first and foremost in front of our people to encourage them to be tested and to know their status at every turn. So thank you for what you're doing, and I encourage others to do the same.
Absolutely. Thank you, Bishop. It made it easy. As you mentioned, there was already a health ministry in place. And so this is not something that we had to create. It was already there, and we were able to use the resources that were available. So it was a seamless process because they were already used to, as you said, hosting, screening, and all of that. So that's the beauty of having a leader who is aware that it is a holistic ministry
Absolutely.
that needs to take place at the church.
Hmm.
So this is to each of you. So I know, as I mentioned earlier, our Men of Zion and then the health ministry of the Amy Zion Church signed a historic memorandum of understanding to address prostate cancer. Why is this significant when we think about how we serve the community?
Are you asking me?
Either three, either one of you can answer, but you can start first, Bishop, if you want to
Okay,
answer.
thank you. It's important, um, again, just to make our folks aware of the of just how impactful this could be in saving lives. That's what we're there for anyway. We're there to save lives. Save lives. Certainly, do we want people to go to heaven, but we want them to live well on earth too, Dr. Perry. And so we want to be sure that we keep that we fulfill our role as the church, to do that, to ensure that our members and congregants and community know that there are resources out there that can help them live and live more effectively and abundantly.
Yes, Dr. Perry.
And I think that this is a pathway for the future, not just for our denomination, but it's like looking back and going forward, because with the Black church, this has always been our focus, the whole body, the whole person. But we put so many other things and so much bureaucracy in the things that we do that we sometimes miss the important items, like having wellness centers, or making this, talking to people about, their health. And so with this new administration, it's pulling us back. I know it does a lot of bad, but that also may be doing some good, because now we know we got to go back to feeding the hungry, clothing the naked, and then and taking care of those who can't who are disinherited, as Howard Thurman would say, and can't take care of themselves or don't have the information. We've got to encourage them. And so, you know, you're being here in this show and the Men of Zion and Finn and PCEC, all of these groups are coming together to do what is right in a nation that's seemingly going so far wrong. I'm just throwing
Amen.
that out as my own opinion.
Amen. Here, here.
You're right. Reverend Clinton, you want to add anything?
It's significant because it is bringing to light a great need for not only our men, but for our entire church. Back in the time of COVID, we did something similar, bringing the vaccine into the church, and it kept a lot of people from getting COVID, and I believe it saved many, many lives. This work here is going to save many lives. And again, we're grateful to Bishop Walker for being bold enough to share his story, bringing to light an issue where a lot of men are in the closet, so to speak. Mm-hmm. And it has been a tremendous help to me just hearing his story. Thank you so much, Bishop, for sharing this today.
And Bishop, forgive me for making any statements to you that might have been discouraging. That was not my intent. Just forgive me. Just wipe it away from your mind. And you'll wipe in.
I forgot at the moment you said it.
Thank you.
Look, everyone told me, said, listen, you're going to hear a lot of things, but listen to your doctor.
That's right.
Listen to your medical doctor. And that's what I've done. But I was just kidding. But at the same time, yeah, you know, so no, it wasn't bad. It wasn't bad. He was sharing with me something that took place early on. Someone that we all knew passed away from prostate cancer, and what their diagnosis was and their treatment plan was. And we were talking about mine, and he said, well, that's what they did. So, and they're not here. I said, well, hold up now. Hold up.
Oh, Lord.
So that was a bit, well, anyway, we're fine.
Yeah.
We're fine.
Yeah, listen, he's gonna be good. That, like you said, Bishop, you have a great team, and you've already started your process. Bishop, we're going to close here, but we want you to give some parting words as you reflect on your journey. What are some parting words that you would like to share with the listeners?
Just get tested. Men, get tested. Encourage everyone you know to be tested. Since being diagnosed with prostate cancer, I have made up my mind. I'm not going to be silent about this, because I have responsibility to stand before people, and every chance I get and every chance I've had, I've shared my story. And I did it at Little Rock. Every place I have an audience, I try to say to the men to please get tested, because you can save your life. And so early detection can save your life, as I know it has saved and will save mine. And please keep me in prayer, my family in prayer, as we go through this journey. We're trusting God all the way. There are too many men who are around us who have been through this, who are still alive and surviving, but we need to be more vocal about it, because I don't think that people, you would be surprised at those that you walk and pass by every day who have been through this already. They just hadn't said anything. Right. But I think it's important that they would say it. I had a friend, and this always stuck with me, who passed away. He's passed away now, but he talked about the fact that his dad had prostate cancer, but didn't tell he and his brothers. And he really felt some kind of way towards his father about that. And his father had survived beyond, he passed away before his father did, but he talked about how he wished his dad would have told him that that he had this to happen to him. And so it's nothing to be ashamed of. You need to share your story, because it could save someone else's life. And I hope that my story will save lives as it would save mine.
Yes, Bishop, we say thank you for sharing your story. Thank you to Dr. Perry, Reverend Clayton for being on today. And just a reminder that early detection through screenings like PSA tests can lead to timely intervention, enabling access for more treatment options and improve your survival rate. And so we want you to get tested because we want you to have the best quality of life. Again, thank you so much for tuning in.
Greetings, I am Maritza Bond, the Director of Health for the City of New Haven, Connecticut, here to share important news. Prostate cancer diagnoses are expected to rise by 80% through the end of this year, especially among Black men. But early detection with a PSA blood test starting at age 40 can make a huge difference. Let's work together to promote awareness and health. For details and registration, visit rapcancer.org. That's rapcancer.org.
Join FEN's Prostate Cancer Community Rally for free educational programs, PSA testing, and lunch. Saturday, December 13th, 9 a.m. to 3 p.m. at Varick Memorial AME Zion Church, 242 Dixwell Avenue, New Haven, Connecticut. For details and information, visit rapcancer.org.